Chair recognizes Councilman Green.
Thank you, Council President. Today is a very important day for many people in this country. It is the 7th anniversary of the signing of the Affordable Care Act. Many of you in this body, as well as throughout the city, are anxiously and somewhat cautiously awaiting the decisions in D.C. regarding the American Health Care Act. My understanding is that the House intends to have a vote by sometime today or this evening or early tomorrow morning regarding that piece of legislation. And I want to thank Councilman Bass, Chair of the Public Health and Human Services Committee, for holding hearings on March 6th to really talk about the impact that this repeal of the Affordable Care Act will have, not only in the city of Philadelphia, but also the Commonwealth of Pennsylvania. One of our Congressman Charlie Denton, who's one of the original co-chairs of the Tuesday group, has stated his opposition to the American Health Care Act. I hope other members of the Pennsylvania delegation, especially from not only the Southeast region but across the Commonwealth, realize the impact that the American Health Care Act will have on not only the city of Philadelphia but the Commonwealth of Pennsylvania. And just some of the facts that we learned at the March 6th hearing that we had is that over 700,000 people benefited from the Medicaid expansion under the Affordable Health Care Act as of 2017. And also under the expansion under the ACA, you have 63,000 new enrollees that receive drug and alcohol treatment. And considering all the issues we have with opioid addiction in the Commonwealth, that's a very important issue. For hospitals, the Medicaid expansion has provided health coverage, and hospitals have been able to spend less money on uncompensated care, and many hospitals are using the money saved to improve care to others. The Medicaid expansion has also created jobs. That's been a misnomer that the Affordable Care Act has been a job killer when it's actually been a job creator. And if you look at the data from the Bureau of Labor Statistics, the states that have allowed Medicaid expansion have experienced 30% more job growth in the healthcare and social services sectors. Finally, as our colleagues in Harrisburg are dealing with the state budget, and the Affordable Care Act since 2015 has saved more than $500 million in the state general funds by shifting people from state-funded coverage to federal Medicaid. So not only do we have a challenge at our state level with our current budget, but if the American Health Care Act passes and the Affordable Care Act is repealed and replaced with new legislation, we'll have additional financial problems at our state level, which will ultimately impact us in the city of Philadelphia and people throughout the Commonwealth in a very negative way. I implore Congressman Dent, others of a more moderate perspective, to vote no on the American Health Care Act. Thank you.
Thank you.